So, in today's class, we are going to talk about an important topic of neurology, that is epilepsy. We will talk this topic in two parts. Okay, what is epilepsy and what are the types and what are the reason? Okay, and what are the diagnosis? First, we will talk definition, types, and different types have different causes and diagnosis, causes, symptoms, sign, diagnosis, and treatment. Okay, all these things we'll discuss one by one. So we'll divide this topic in first part and second part. Okay, today we'll talk what are the important things related epilepsy. Let's start with definition. So basically, we know that our brain is a wonderful organ. Okay, and it have more than 100 million neurons. Okay, and some scientists told that more than 600 million or 60 million neurons in the brain. Okay, how the neurons connect with each other or transfer their information from one neuron to another neuron. This is known as, we have two things, that is, one is by electrical stimulation and another one is chemical stimulation. Okay, so both our neurons transfer their information within the neuron, is the electrical stimulation. Electrical stimulation within the neuron. Outside the neuron, it is chemical stimulation. Okay. So what happened in epilepsy? There is an abnormal movements of chemical or electrical stimulation within the brain, and it is sometimes appears, sometimes disappears spontaneously, continuously. Okay, and there is the chances of reoccurrence. Okay, this is known as epilepsy. Okay, what happened? This electrical stimulation sometimes arises. Okay, sometimes decreases. The chemical stimulation sometimes arises. Okay, so what will happen? That because of that reason, motor activities are vigorously seen according to the area where the electrical and chemical stimulation occurs. Okay, this is the first thing. Second thing is that the movements are, whatever vigorously occurs, it occurs suddenly and it will occur reoccurrence. Okay, means after 1 week, after 1 month, any stimulant which stimulate the abnormal activity within the brain, okay, will cause the epilepsy. Okay, so this is the epilepsy. Let's see in the image also. You can see the the meaning or by the within the brain. Like this is the current flow or electrical stimulation. But what happens suddenly it arises. Okay, suddenly it arises like this. The electrical stimulation is suddenly arises and it will go to the all the parts of the brain. Sometimes it one area, sometimes it's spread all over the brain. Okay, this you can see that the stimulate. This is the electrical waves. Okay, so now we will talk about this is the thing we have to understand. What are the things we have to know about the epilepsy? One is what when did the epilepsy will occur? Mostly nowadays we are seeing the children's below 5 years, or some babies have, some children have by birth. Okay, children's and after age of 30 years, more than 30 years. Reason behind what is that we will call will discuss. So already I told you that there is a chemical stimulation or mechanical or will electrical stimulation. What will happen in the chemical stimulation? What is the chemical release by one neuron? The message is passing to another neuron. Okay, we will also call synapse. One end is dendroid and one end is axon. Okay, so with the help of this chemical, the messages will pass. What is that name of the chemical? That is acetylcholine. It will happen acetylcholine. What happened? There is a failure of acetylcholine production and metabolic loss of glutamic acid. What will happen? So the what happened? This here the loss of acetylcholine will seen. Loss of acetylcholine is seen. So but stimulation again it will have very serious effect. Okay. So this is the cause of one acetylcholine. Why this happening? Why the acetylcholine is not functioning? We will discuss later. First, you have to understand the etiology. Next is physiological mechanism. Already I told you that there is a stimulation within the nerve cells, electrical stimulation. Okay, some part of the brain in any area of the brain, okay, is affected. Okay, affected for what happened? It may be cerebral area, parietal area, frontal area, or occipital area. Any area is affected. Sometimes our memories will trigger that epilepsy, sometimes some emotional conditions, sometimes any anger issues, anxiety will also trigger that part which is affected in the past. Okay, what will happen? There is a sudden discharges of electrical impulse from that area. Okay, so that's the reason you can see the abnormal activity within the body. Okay, so this is the physiological mechanism we will call. There is a past history of damage of that area. Okay, it is cured, but anything which triggers that part of the brain which can stimulates more electrical impulses, which leads to generate abnormal electrical mechanism, abnormal electrical stimulation, which leads to epilepsy. Okay, so this is the very easy way to understand. So most of the uh, persons or who have epilepsy, they are sometimes by birth because during pregnancy, during childbirth, there is a trauma, uh, any infection, okay, which leads to epilepsy, or sometimes premature baby may also responsible for epilepsy. Okay, and cardiovascular diseases or cardiorespiratory disorders leads to epilepsy. Okay, so trauma, infection, or prematurity. Okay, and cardiovascular diseases. These are the reasons behind in the in the uh, neonatal babies. One is trauma during delivery. Another is an infection chances. Second is cardio CVS diseases or respiratory diseases. These are the common factors which leads to generate epilepsy. Okay. And other than that, we have one common thing, that is tumors. Okay, tumors are the most common reason behind the epilepsy. Tumors, cerebral tumors. This is the most common reason behind the epilepsy. Most of the people have cerebral tumor because of which attacks the part of the brain which leads to increase the uh, electrical stimulation. Why the tumors have occurred? Due to the infection, maybe, or intoxic or a toxic substance, or like alcohol consumption, chronic alcoholic, which leads to cerebral tumor also. Encephalopathy, hypocalcemia, okay, pyridoxine deficiency, drug addiction, and hypoglycemia. These are also reason behind epilepsy. So one is general cerebral tumors, okay, are the reason behind epilepsy. Other than that, what happened? Chronic alcoholism are the reason behind epilepsy, and we have encephalopathy, infection of the layers of the brain, okay, and we have hypocalcemia. Hypocalcemia is one of the reason behind epilepsy. Okay, low level of calcium, because there is a excess low amount of production of calcium, which leads to decrease electrical stimulation in the brain. Okay, hypocalcemia and paradoxic deficiency, vitamin B6, B12 deficiency, and we have any drug addiction which leads to epilepsy, and we have hypoglycemia. Hypoglycemia also leads to epilepsy. So these are the reasons. Okay. So epilepsy, what would discussed about definition of epilepsy. Okay, and what are the causes? Now types. We'll talk about types of epilepsy. One is grand mal epilepsy. These are the types of epilepsy. Okay, these are the types of epilepsy. Grand mal epilepsy. Okay, this is the first thing, and second is pit mal epilepsy. Okay, and the third one is focal epilepsy. Focal epilepsy, and the fourth one is not common. Jackson ion epilepsy. These are the four types. Now, first one we'll talk about grand mal epilepsy. Two are very common. One is grand mal epilepsy and focal epilepsy. Grand mal also get generalized epilepsy also. We'll call generalized epilepsy, like we already seen here. Generalized epilepsy. All the uh, part of the brain is affected. Focal means only one part of it affected. Okay. So let's discuss all this four. Today we'll discuss only one type. It is grand mal epilepsy. So grand mal epilepsy is also called motor epilepsy. Already told generalized epilepsy, all motor epilepsy. Okay. So what are the symptoms? So these will start with few hours to several days. First thing is that. And second is that these symptoms are usually paroxysmal or continuous. Continuously, the symptoms you can see the patient will, whatever thing he will do. The temporary symptoms are feeling of strangeness with sudden myoclonic jerks. The patient have jerks affecting the group of muscles, mainly the muscles of extremities are involved. There is sudden momentary abdominal pain, hiccup, and palpitation of heart. So these are the symptoms, continuous symptoms present for 1 or 2 days. Patient is depressed with generalized headache or pallor. Okay. So here what will happen? The main symptoms are like movement of extremities or sudden movement of extremities, and the patient have abdominal pain, hiccup, and we have palpitation of heart. Okay. And other than that, the patient have group of other symptoms sometimes with convulsion. We will also call convulsions. Okay. The patient will have very unconscious like things, and he will have vigorous movement of his active extremities. Other than that, extremities, abdominal pain, hiccups, palpitation of heart, all this you can see. Okay, sometimes they have other things. If it is, if problem is increased, the patient have breathlessness also, and nausea, breathlessness, nausea, vertigo. Okay, let's write it. SOB, shortness of breath, nausea. Sometimes they vomit also. Okay, in the motor epilepsy, grand mal epilepsy. Okay, and the patient have vertigo, they will fall. Okay, or sometimes they will have psychiatric effect also. They will fall and they will try to run and they will cry. Okay, they suddenly fall and unconscious. Okay, and they have sudden shouting sound from the abdominal. Okay, this is also epileptic cry, what we will call epileptic cry. Okay, this is very screamy. Okay, sometimes we have uh, will we are unable to see the patient. Okay, and sometimes the patient have loss of consciousness. Okay, so the patient have clonic convulsions, and these are the things we have to understand when the epilepsy is coming, is happening to the patient. Okay, the patient have loss of consciousness. LOC, loss of consciousness is available sometimes unavailable, and have tonic spasms. What is tonic spasms? Whenever patient become unconscious, his body becomes very stiff. head upside, eyes scrolling, rotator one side. Okay, and the spasm appears in the like this. Okay, and the deep cyanosis, his skin color which changes. Okay, and sometimes if he fall, that condition you fall down, what will happen is any dislocation, any fracture will happen. Okay, this is called tonic spasm. And the clonic convulsions, in which what will happen because of the unreachable of oxygen to the brain. Okay, and this the mostly the muscles are not stiffed, they are okay. Okay, but they are contracted like this. In the tonic like this, in the clonic like this, contracted. Okay, strong contact. You are unable to um, uh, hold his hand. Sometimes we will give what will you keys or iron rods, whatever thing, iron rod, anything. Okay, and they have saliva, frothing from mouth, and tongue bite is there. In the clonic, there is a tongue bite. Okay, and the frothing from mouth. Okay, and sometimes the pupil are dilated like big. Okay, like this. This is they are some screamy or like a dangerous eye become. Okay, sometimes urinated patient will urinate, or sometimes he will pass the stool. Okay, and his blood pressure, BP, everything will be increased. So in this condition, what will this is called grand mal epilepsy. So this epilepsy attack is few minutes from hours or days. Some patient having clonic convulsions, tonic spasm. We already studied that they have uh, these are the symptoms. Extremities will become stiff. Okay, or in the clonic convulsions, it will contract. Okay. Other than that, abdominal pain, SOB, vertigo, nausea, heart palpitation, hiccups, okay, and the loss of consciousness, frothing from mouth, pupil is dilated, tongue bite, okay. Sometimes in the tonic spasm, if the patient fell down, what will happen? Dislocation will happen. So this is the grand mal epilepsy. Okay. So in today's class, we discussed something little about the epilepsy. So we'll continue tomorrow also. Tomorrow we'll discuss petimelial epilepsy, epilepsy, Jacksonian epilepsy, and the diagnosis and treatment in electrohomeopathy. Okay. And what are the uh, things we have to do during the epileptic attack? This will also will talk about. Okay. Because we see number of patients in the family, in the social, in the gathering, while gathering, and while traveling. Okay. So that's the reason I want to tell you about that. Okay. So any doubts you can ask.